Okay, so let's talk about lung contusions. So when we're talking in a pathophysiology manner, we are talking about damage that cause endothelial damage. This cause extravasation of blood into the interstitium, into the alveoli of the lungs. This is the idea of contusion, lung contusion. The area in which we expect to see this lung contusion is mainly near area of solid organs, solid structures. For example, near the ribs, heart, liver, vertebra, somewhere that there can be a contusion there. Endothelial damage, extravasation of blood, and everything. We need some solid thing that it can occur at. Now, be aware. Be aware that it takes time after the injury, so you will see that in your imaging. It takes around 6 to 24 hours after the injury to appears. Now, another extra or clinical finding that can be seen in contusion, another one that is not seen just in the lungs, is hemoptysis. So if we coat up blood, it is in up to 50% of patients. Now, of course, it's important what is the size of it, but it can be very serious and can have high mortality rates. So be aware of lung contusions. And if it's not, or if it's big, so take it very seriously. It can have high mortality rate. Now, what are the radiographic features of lung contusions? So there is a hemorrhage, there is edema. Therefore, in a plain X-ray, chest X-ray, you will see opacities in those areas. So look for the pulmonary opacities that represent hemorrhage, represent edema. Now, you can see on CT, of course, the contusions, but also air bronchograms, area of hypodensity in the hyperintense area, in the distribution of the lungs and bronchioles and everything. So in the area where air travels, this is the hypodense area, and around it, the edema and the hemorrhage cause hyperdense areas. So this is called air bronchograms, this hypodense area inside the hyperdense area. So you may see air bronchograms, not always, but you may see them. Again, the contusion, remember, the contusions can be seen 6 to 24 hours after the trauma. So if the patient 2 hours ago got the trauma and now the imaging looks normal, be aware, this patient can develop imaging changes later, and now you just may not see the damage. Now, how much time it takes for it to resolve? Around 7 to 10 days until those changes resolve. Now, sometimes you wait 7-10 days and still you see that the contusions, the opacities that you saw in imaging, they don't resolve. What can it be? It can be hematoma, post-laceration, aspiration of something. It may be even infection, pneumonia, hospital acquired. It may be that the lungs just collapse there, the alveoli collapse, what is called atelectasis. And it may be that the patient develops some kind of non-cardiogenic pulmonary edema in that area, what is called ARDS, acute respiratory distress syndrome in the lungs. So this hematoma, aspiration, hospital-acquired pneumonia, atelectasis, ARDS, those can explain why after 7 to 10 days you may see that the contusion does not resolve. So this was about pulmonary contusions, especially in the imaging idea of it. Thank you very much, and that's it.